Good morning. My name is Katjana Ballantyne. I'm the Mayor-Elect of Somerville. Today we will be talking to you about how we continue to work together to respond to COVID and prepare for the ongoing recovery. Mayor Curtatone and I have worked together to ensure a seamless transition to slow down the spread of COVID, protect our residents, and to that end, we'd also going to be submitting a Board of Health order similar to Boston. Our communications department will share the details with you. This order will ensure consistency across borders, protect our residents, level the playing field for residents and small businesses. The timeline for rollout will be similar to Boston for all businesses and restaurants. And right now, I will pass it on to Mayor Curtatone.
Good morning. Thank you for joining us. I want to thank Mayor-Elect Katjana Ballantyne. If you can imagine, her and I are transitioning in a very complex process after serving here for 18 years. But alongside with my colleague as she served in the City Council and led with equity, with deliberateness and boldness, and we're very fortunate here in Somerville that the incoming mayor has already been hard at work, as you can see, and closely coordinating not just a seamless transition of all the critical operation of the city, but certainly in our response to the pandemic. Throughout the pandemic, since the very beginning, city leaders have come together as we were forced to. 351 cities and towns, 400 school districts have figured it out. And together, communities large and small, rural, urban, suburban, moved to implement restrictions on activities, roll back certain activities, institute and launch pool testing, understand how to safely and equitably reopen activities throughout the year, and help people access testing, vaccines, especially those who didn't have technology or mobility resources, or maybe at home because they're frail. And that leadership and that coordination is critical, as was evident as I was joined by Mayor-Elect Ballantyne yesterday, along with the Mayor of Boston, Michelle Wu, and other leaders, to announce in solidarity, again, our call for regional approaches to keep all our communities safe, all our residents healthy, safe, and alive. We know vaccines are one of the most valuable tools to fight this pandemic. And first, I do want to say, as I've said often, I am as done with COVID personally. We all are. But it is not done with us. We can either control the virus or it will control us. And we cannot lose sight or forsake what we've lost. That we can even measure. 99 souls in Somerville, about to eclipse 20,000 in the Commonwealth of Massachusetts, a state with deep in financial, health, hospital, research resources, one of the leading death rates in the nation still, and that is unacceptable. But we get the calls locally when someone dies. I've gotten all those calls, and you don't want to get them. We know when people are about to be evicted, lose their homes, or lose their dream of a small business and their life savings. We receive those calls as counselors, as local officials, as mayors, city managers, administrators. They're painful, and we always ask ourselves, have we done enough? Our goal, paramount to anything else, anyone's convenience, is to keep everyone, our community, those who live here, those who work here, raising their family, those who frequent our businesses, those consumers and customers, safe, healthy, and alive. Our responsibility as public leaders is to lead with that at the center, lead with equity, and interrupt. All of us have responsibility to do what we need to do to interrupt the transmission of this virus from person to person. We are at a certain point here that should not be shocking. It's been predicted. We are not only in a surge, but we're about to face the triple whammy. Omicron variant on top of the Delta variant and the cold and flu season. So we need to live smart with this virus among us so we can keep everyone healthy, safe, alive, and we're not rolling back to what we were many months ago. And we have tools that work. You need to wear a mask in crowded places, especially with people you don't know. You can get tested and get vaccinated. vaccines work and save lives. The more people who are unvaccinated, the more compounded the consequences will be, and the more at risk, especially those who have compromised immune systems or weakened health status, will die or become seriously ill. We do not take these and make these decisions lightly. Consistently, we've worked throughout many months as part of the legislative bodies, executive bodies, as municipal leaders to look at science, be guided by the leading experts, to be deliberate, methodical, and decisive. And our approach will remain the same. As has been mentioned by Mayor-Elect Ballantyne, this will be going before the Board of Health this evening for their consideration, their deliberation, and they will make the final call. We will also do what we always done, engage in all stakeholders in the communities in these decisions, especially our local businesses, and this will lead into the other announcements we're making today. We know our economy has taken a hit. We know local businesses, especially restaurants, which is already a strained and difficult industry to manage, have been really under it these months. But I'm proud of our work together as a community to bring the direct resources we have to those businesses and their employees to sustain and come out of this stronger. But we need to be clear. It is not the restrictions or guidelines that are hurting business and the economy. We're not fighting the economy. We're fighting the pandemic. And until we have a healthy recovery for everyone, we cannot have a sustainable, healthy recovery of our economy. But we're proud of how we're approaching it in Somerville. First, in consultation, coordination with my colleague, the Mayor-Elect, and her administration that is incoming. We are already analyzing, considering, and be working, engaging our small business community, our business community as a whole, organizations like the Chamber of Commerce, our Main Streets program in Union Square in East Somerville, to understand how we can utilize ARPA monies and leverage that to help businesses be ready to implement and comply with the guidelines. And we'll do so with their consultation. When we had to reopen, when we instituted rollbacks and restrictions many months ago, is with their guidance and perspective that helped us do it with the right context in a way that made sense while keeping everyone healthy, safe, and alive, especially their workers, their employees, and their customers. Today, the other important announcement we're going to make in relation to ARPA is that Somerville in all has $77.5 million in ARPA funds to spend on items such as public health initiatives, assistance for vulnerable populations, and economic recovery. ARPA funds have also been previously dedicated to the pandemic emergency and recovery needs, as well as an initial investment in staffing to develop the Digital Bridge initiative to overcome inequities in the digital internet access. So what we've done as a community, and this is important here in our work, because the recent news of Senator Joe Manchin's opposition to the Build Back Better plan under the Biden administration is disheartening. But it is not going to deter our advocacy, our activism, or local action to make sure we address the inequities of the entire system that should have been glaringly obvious throughout this pandemic. The needs of our working class families, of those with worse projected health outcomes, who has to work the frontline jobs to support our conveniences because they can't work the white-collar jobs, they cannot work remotely, putting themselves and their families at risk, and the many other inequities and disparities in our system. That's the purpose of Build Back Better, to come out of this pandemic that everyone, not some, everyone, and we lead with equity, has that opportunity to do better. So the City of Somerville, and working together, has established an internal staff to manage the distribution of these ARPA funds. And we've enlisted and utilized the partnership of the MAPC, the Metropolitan Area Planning Council, to help engage every sector of the community as these decisions are made and on a regional basis. So we've already engaged an initial round of community input and advocacy, seeking to identify how we as a city, as a community, can lead with our values and lead with equity. And we're proud to announce that the first round coming out will dedicate $9 million in funding to childcare, to rental assistance, and universal basic income pilot project. So let me be clear. The need for these funds and for these programs, as we're talking about, was glaringly obvious before the pandemic. And coming out of Washington news that some will run away from facing the realities of what our residents in every state and every community are in need for to come out of this stronger, and who's suffering, again, is disheartening but not deterring to us. We worked collectively and prioritized an unprecedented infusion of $7 million into direct child care supports. And that makes up the majority of the allotment, in which will fund needed affordable daycare, pre-kindergarten allotments for children ages 1.5 to 4 years old. Again, but before COVID, we've seen this, and much like our approach in COVID, we leveraged and depended upon data and analysis, and that has said that access and quality child care were already holding back our families. And the pandemic has only deepened that divide and compounded the inequities, keeping even more parents and guardians out of the workplace and cutting off access to education advancement. So we got to get people back to work. And if we want to get people back to work, that means not only having our children remain in a safe and healthy setting in schools, but making sure this need for affordable daycare is addressed. And we have that opportunity now to launch that, and Somerville will lead that. And for many who do not have child care, paying for it leaves little left for anything else. We know that. So we hope the federal government will start to lead more on that. Senators Manchin and others will come in line and lead on the Build Back Better plan, or even better. The child care funds will be administered by the city's Summer Promise Office under the new Ballantyne administration. Rental assistance and universal basic income pilot project each will receive $1 million. The city is also looking at an additional $3 million for a free and reduced transit pass benefits program targeting retail workers, public school students, and parents and guardians, and the municipal workforce. Again, the pandemic showed us many things. It made it obvious that who has to get to work by public transportation. There was even consideration of cutting that service. And the folks going that they're black, they're brown, they're poor, they're immigrants, and they're doing the services that support us and uphold our economy. And this has guided our initial decision here together. Somerville has already launched in the midst of a student free public transportation program, and that data has also guided us. The rental assistance will be distributed through the Community Action Agency, which is our local anti-poverty agency here in Somerville, CAS, and the Somerville Homeless Coalition. And those funds will be in addition to the more than $2.3 million in rental assistance the city and partner agencies have already distributed. And I do want to say on the business side, I mentioned the ARPA funding. We can consider it analyzed, understand what is the amount that is right. That'll be on top of the several $1 million put out in local small business assistance, which we're expanding the latest round as we speak. On test kit distribution, with the new surge picking up speed right before the upcoming holidays, these kits could not come any sooner. We want to thank and applaud Governor Baker, Lieutenant Governor Polito, and the state administration. We appreciate that when we join their call to our leaders in Washington to make these test kits easily accessible. You should be able to get them. And you shouldn't have to seek reimbursement. They should be right at your fingertips. If we understand collectively if we're infected or not, we're going to hopefully assume the responsibility of isolating ourselves or seek further testing or medical treatment. So again, we can interrupt the spread. So we want to applaud Governor Baker and his team. And we are rapidly working to ensure a swift distribution, as we are speaking here now, of 16,000 kits to our hardest hit residents so that they have more tools to help protect families, themselves and their families. Now, the bulk will be distributed through the Somerville Public Schools, as I mentioned, starting today, but then there'll also be a targeted outreach to the students whose families face the greatest barriers to access to on-site testing or purchase and home tests. But we'll also be working in collaboration and already reached out to our partners in the community, mobilizing city staff who serve the most vulnerable community members to distribute the test kits throughout their channels as well. Everyone, it's been all hands on deck since the beginning of the pandemic. Are out there to get these out before the rest of the holidays, The DPW will be delivering directly to community partners. The schools is already on it. The City Council, the Council on Aging will get the test kits to our senior population, those who have identified as high-risk elderly. Health and Human Services will partner with the food pantries and the Office of Immigrant Affairs, SOIA, is focused on getting to partner nonprofits and families in some of our hardest hit communities. We know who they are. We've been engaged, and again, emblematic of some of those communities' spirit of watching out for one another. It's inspiring to see people come together to look out for one another and get these out. Our communications department, as has been mentioned by Mayor-Elect Ballantyne, is working to get out easy and read print and video instructions in several languages, so it's easy to learn and why and how to use them. But again, I want to commend everyone in this community, everyone for looking out for one another, the city team, the incident command team, from the very beginning, stepping out of their comfort zone, all hands on deck to keep everyone in the city healthy, safe, and alive, and to ensure a healthy recovery in our economy. As to the Board of Health order, as has been mentioned, the specifics are there, has been outlined, true to how we've considered as a community any guidelines, rollbacks, openings, or restrictions necessary to interrupt the transmission of the virus. That is based on the highest level of expertise, the most recent data, analysis, and information, how the pandemic and the virus is evolving right before us in our schools, in our neighborhoods, in the region. And they will take that up for consideration, has been outlined and been shared with all of you at their meeting this evening. This will be their deliberation, their decision as an independent body, administrative body here in the city of Somerville, charged with promulgating all the health protocols, guidelines, and procedures to keep us all healthy and safe. The timing has been outlined for all of you that is being suggested in consideration to the Board of Health, January 15th, Phase 1, phasing in February 15th, Phase 2, and it speaks to the age groups there, Phase 3 on March 1st and Phase 4 March 22nd. In the meantime, we are launching the work in collaboration with all stakeholders, allies, establishments, businesses, to understand how they can comply, how we can help support that compliance in a way that is seamless, keep everyone safe, keep our economy going. At this point, I'm going to stop, invite you to ask any questions you may have. We may provide follow-up information in greater detail if it's not before us. On behalf of Mayor-Elect Katjana Ballantyne, myself, thank you for coming out today. Happy to take any questions. We need to be set up to do it. It's a good question. Let me repeat it for those who haven't heard it. We know the positivity rate goes up immediately after holidays or gatherings, and why not start it now? We want to set up our community for success. Many have questions. Many businesses and establishments, I want to be clear, do this already, and the majority are in support. One small story, when we were back in the spring, and the guidance was if you're vaccinated, you don't have to need a mask. My gym, health club, asked folks for their vaccination proof. People were proud to show it. Some still determined to wear a mask otherwise. But we need to make sure that we're transparent, we're clear. Stakeholders, businesses, establishments have questions. We'd love to move faster. I'd submit to you, to your question, this is action we should have taken as a Commonwealth weeks, if not months ago. I just traveled to Canada, where in addition to the guidelines and thresholds I had to cross to show vaccination proof and testing to enter the country, if I walked into a coffee shop, I was asked, "Sir, would you be having your coffee here?" And so I had to show my vaccine card. If I went to a hockey rink to watch my son play, everyone had a mask on, in compliance, did a safety screen, showed their vaccination proof. It was seamless. The businesses were thriving, and my casual conversations with workers, they were appreciative. They weren't concerned about their health and well-being. And I'd submit our customers, our constituents will appreciate it more. So yes, it should have happened more, but we need to make sure we're doing it right. There's a lot of steps we need to take, not just the approvals by the oversight board, such as the Board of Health. There are resources our businesses and establishments need to help train their staff and capture that information screen. And our role here is not to be punitive, is to ensure compliance so that we ensure everyone is safe. Thank you for that question. The question is, can I summarize the mask mandate in Somerville? And you referred to the governor's advisory, which I saw across the state, about advising to wear masks in certain circumstances. Do I wish you would go further? Absolutely. There should not be loose guidance and rules. You have two different extremes. When you have a former president who's undercutting and belying all the facts and the highest level of expertise in the face of the pandemic, in the midst of a pandemic, which I'd submit, and the data will show, resulted in hundreds of thousands of lives that we could have saved. There's also, and I respect the governor, we don't always agree. I don't agree with him on this one. I applaud him for the test kits and other things, and I do believe he cares. But to put out loose guidance for 351 cities and towns, 400 school districts, viruses like water. If we want to stop water from coming into your home, you construct an impenetrable barrier with no seams, no gaps. Somerville, I'm the mayor, she's about to become the mayor of the most densely populated city in New England. And look outside my window, we're closer to downtown Boston than most of Boston. Our residents travel on the same transit systems. We frequent the same establishments. So when you have loose rules, like water, the virus finds a way. It has found a way in buckets. We're about to eclipse 20,000 deaths here in Massachusetts. I put out my call again, and I join other municipal leaders. We need deliberate, bold action, and these are practical steps. Wear a mask. In Somerville, you must wear a mask in indoor establishments. Other than when I'm speaking here, and we're apart, you all have masks on. You must do that. And we laid out when. And, we're out there with our ambassadors, encouraging and making sure people are in compliance. In my gym, it's pretty good compliance. I know other places we need to work on that. But when your elected leaders don't demonstrate the seriousness of the situation, and our guidance, our calls, our rhetoric don't parallel that, well, I will tell you in the words of a local leader, as we fought, I've been fighting months for more regional coordination in some of the smaller towns, saying, I'm all in, but when the state or the governor doesn't say it's that bad, well, then people interpret it's not that bad. So, yeah, there should be an order, and there should be a vaccine from the state, and it can be regionally based. Again, we can either control the virus or it's going to control us. Thank you for the question. We ask, I will say, our answers, and please correct me, will be ethical. We, from the very beginning, have told our entire community what we know, what we don't know. And let's be clear, no one, and we certainly didn't have a pandemic response plan, but we know so much, right? We have so many tools at our disposal from the beginning. And we'll tell them why we're doing it. The reaction overall throughout the months, even those who had initial concerns and disagreement, have been respectful and constructive. Most understand that we cannot have any high level of consumer confidence if people feel unsafe going to your restaurant or your health club, or if your workers, who wants to work in establishments where they think they might contract the virus or bring it home to someone who's recovering from cancer, or who is elderly, or some other immune, and another immune compromised state. So, one, we're all in this together. Like the cities of Boston, we are going to work, as we've done in the beginning, to not only help the businesses and establishments comply, to get their perspective, to understand how do we approach this, and to provide them the resources, which we will work with them in doing. And I full faith and trust in our new administration coming in, that they have the financial resources to do that. On the consumer confidence side, let's ask this question. If you're going to come to Somerville, assuming the Board of Health acts positively on this recommendation, or Boston, or another community that takes these steps, if you choose to go there, at one of our great restaurants and establishments, and no knock to Michelle Wu in Boston, we'll take them up anytime on a challenge, or would you go to another place where you're at risk of transmitting or becoming infected? You're going to come to our establishments. The one point, which is extremely, very valid, and we are aware of, is when we hear from establishments, well, why is it that we're enacting in Somerville or in this city, but the others aren't? That's a fair point. But it does not justify any of us abdicating our responsibility to do what's best and to lead. So that's why we work together, and I didn't go into much detail, many months ago with the City Council and the business community. We infused millions of dollars of direct money, forgivable grants, loans to small businesses. Some cases up to $25,000 to pay employees, keep their establishments going, and come out of this stronger. And that program is actually being expanded, and we'll double that up or more, work with the new administration in terms of how we help to support them to get through it. And that's going to be my response. But we're going to listen. We're going to tell them in an ethical way what we know, don't know, why we're doing it. And we're going to work hand in hand with them to keep everyone safe, their workers, their customers, our community. I'd submit overall we're in alignment. Another question? It doesn't feel like it's slowing down. There's a lot of, I reflected on this last night. It's a job I love and I'll miss. But I'm reminded today of the grave responsibility, the profound responsibility of the quality of life of everyone in our community, of these decisions. And going back to that point about the businesses, I want to say I'd often respond that I have no good answers for you all today, or the community. I'm going to give you the best of the bad news. And I think it's important we're ethical. But the community helped me survive and sustain. But I'm feeling great about Somerville. One, the mayor-elect and her team coming in, because I know she'll lead with equity, with values and boldness, and lead the region. We need the region. And I'll have more to say down the road. Right now, I'd only ask people, I had one favor I said last night, one of two. One is look out for one another, keep each other safe. And that's been inspiring. As I spent out of the last 20 months, about 14 of them, 15 on my, pretty much on my own here, but hearing the stories of who was helping to volunteer, deliver food, feed people, checking on an elderly person, shop from a local business. That sustained me, and I know the new mayor, the mayor-elect, thrives on that value, not value narrative, but that value action by the community. But thank you for the question. Thanks, folks, for coming out. Madam Mayor-elect, would you like to say anything else? On behalf of both of us, to the community, we're going to get through this like we always have. We're going to work together. We're going to lead with equity. And I ask everyone in the Commonwealth to keep themselves safe and be smart about how we live with the virus, especially in this holiday season. We're much better off than we were before, but we still have people who are getting very ill and are dying. Let's not forsake those. Have a happy holiday and Happy New Year. Thank you.